Welcome to Healthy Living. Top 10 signs your blood sugar is high and diabetes symptoms. Now let's get it on. Blood sugar, or glucose, is the main sugar found in blood. The body gets glucose from the food we eat. This sugar is an important source of energy and provides nutrients to the body's organs, muscles and nervous system. The absorption, storage and production of glucose is regulated constantly by complex processes involving the small intestine, liver and pancreas. Now let's talk one by one. 1. Hunger and fatigue. Your body converts the food you eat into glucose that your cells use for energy. But your cells need insulin to take in glucose. If your body doesn't make enough or any insulin, or if your cells resist the insulin your body makes, the glucose can't get into them and you have no energy. This can make you hungrier and more tired than usual. 2. You have noticeably blurry vision and frequent headaches. You may notice that your vision isn't as clear as it used to be and that things may appear a bit blurry. High blood sugar levels can lead to swollen lenses in your eye from fluid leaking in. This changes the shape of the lens, which makes it unable to properly focus, causing blurred vision. You may also find yourself struggling at work, having difficulty driving, and suffering from frequent headaches. 3. Peeing more often and being thirstier. The average person usually has to pee between 4 and 7 times in 24 hours, but people with diabetes may go a lot more. Why? Normally, your body reabsorbs glucose as it passes through your kidneys. But when diabetes pushes your blood sugar up, your kidneys may not be able to bring it all back in. This causes the body to make more urine, and that takes fluids. The result, you'll have to go more often. You might pee out more, too. Because you're peeing so much, you can get very thirsty. When you drink more, you'll also pee more. 4. Dry mouth and itchy skin. Because your body is using fluids to make pee, there's less moisture for other things. You could get dehydrated, and your mouth may feel dry. Dry skin can make you itchy. 5. You notice tingling and numbness in your hands or feet. Uncontrolled blood sugar can cause nerve damage, also known as diabetic neuropathy. What you may notice is a tingling sensation or even numbness in your hands and feet. Some people experience pain in their hands and feet as well. Though neuropathy is most common in people who have had diabetes for a long time, it can occur in anyone with poorly controlled diabetes. 6. You're developing blisters, dryness, or other skin changes. Small pieces of extra skin, called skin tags, may form in the creases of skin, especially if you have diabetes and you're trying to find ways to manage your weight. Dark, thick areas of soft skin, called acanthosis nigricans, may form on the back of the neck or hands, armpits, face, or other areas. These can be a sign of insulin resistance. Blisters, infections, dryness, itchiness, discolorations, and abnormalities of the skin can all be warning signs of high blood sugar. Check with your doctor if these skin changes develop. 7. Nausea, vomiting, confusion, and more. These seemingly disparate symptoms are all signs of a rare and life-threatening state called diabetic ketoacidosis (DKA). DKA can cause the symptoms above, as well as stomach pain, trouble breathing, dry or flushed skin, fruity-smelling breath, or difficulty paying attention. It usually occurs in people with type 1 diabetes and is sometimes the first sign they are sick. Unable to use the sugar in the blood for energy without insulin, the liver begins to break down body fat into a type of fuel called ketones at such a high rate that they become toxic and make the blood acidic. DKA can be fatal if left untreated, so anyone experiencing these symptoms should seek care immediately. 8. Swollen or bleeding gums, which increase your infection risk. Your saliva contains glucose, and the more it contains, the more there is to feed the bacteria that combine with food in your mouth to form plaque and cause gum disease. Symptoms can include red or inflamed gums at first. If they are unaddressed, they can progress to periodontitis, which can cause your gums to pull away from your teeth, the appearance of pus or ulcers, or even tooth loss. Get your blood sugar under control and see a dental professional to prevent damage to your gums and teeth. 9. Recurrent infections. Consistently elevated blood sugar levels can weaken the body's immune response. This makes it harder for your body to fight off some infections, making them more frequent, lingering, or serious. Especially tends to see frequent yeast infections in women with diabetes. This is because excess sugar from high blood sugar spilling out through the urine helps feed the bacteria that can cause these infections. 10. Dental issues. Glucose is present in your saliva as well as your blood. When there's too much of it, it helps harmful bacteria in your mouth grow and combine with food particles to create plaque. This leads to issues like tooth decay, cavities, gingivitis, gum disease, and bad breath. In both type 1 and 2 diabetes, the best way to prevent high blood sugar is to follow your treatment plan and talk to your doctor if something is not working for you. This all are the warning sign of blood sugar. Thank you for watching.